this room. Thank you very much. And I will, with this, ask our first speaker, and that is Dr. Damjan Osredkar, leading the clinical story here, which currently is the one that is leading the way. Damjan, the word is yours.
Hello. Hello. Dear children and parents, dear researchers, dear Dean, dear Mrs. President, dear friends, it is our greatest honor to welcome you here in Ljubljana to the second World CTNNB1 conference. The forecast has it that there's going to be sunshine the next day, so I hope that you will have the opportunity to explore our beautiful city, Ljubljana, which is also called the Little Prague of Europe or the Hidden Gem. But there's another source of light that inspires us today, and this is the CTNNB1 community that we have built together. I still remember very vividly the day when Špela came to my office and asked for help for her son. But at that time, any kind of treatment for the condition was just a distant dream. So, but it was the very day when the strong CTNNB1 community that we started to form started to have shape. We were able to connect with various different families from around the world who were able to participate and who were willing to share their experience and with a common goal to help their loved ones. We were also able to connect with excellent researchers around the world who were willing to take on the challenge to develop a therapy for the condition. And this has been an incredible journey that we have had. We have learned a lot about the disease, and we have also been able to explore different treatment approaches. And with a candidate gene replacement therapy now in the early phases of the development, we have actually walked a very long path already, and we have great future ahead of us. We have, therefore, I mean, I am sure that the CTNNB1 story is actually a very bright beacon for all patients with rare diseases in Europe, because we have shown that by coming together and joining our efforts, we can achieve incredible things. So with that, I would like to thank you for your continued participation in the studies, and I would like to thank you for coming to the conference from near and far. Thank you for coming to Ljubljana.
With this, I'm inviting Špela Miroševič, the leader of this movement and the person who started all of this and immediately got supporters. Špela, we are all supporting you. Thank you very much.
Thank you, Gregor. I was so excited last night. I couldn't sleep. I hope you are too. Having 82 children and families here is beyond I have ever imagined. Thank you, all the families and all the children that are here. We are all together fighting for the brighter future of our children. I would also like to thank our partners. I would like to thank our researchers and clinicians for fighting together this battle with our families. I would also like to thank our sponsors, donors, who are enabling this amazing conference, and of course, are an amazing team of volunteers. We have, by the way, 80 volunteers here helping you and your families, which I have been gathering for the past months, visiting universities to get them here for you. And I would also like to specifically thank Bruno. He's here somewhere, maybe if he's not examining children. And also Charlotte and Fiona, who have been behind the clinical examination, which we have been doing for the last night until 2 a.m. and weeks behind. And also my mother, she's here in the red jacket. She has been in the reception. She knows everybody. She knows every name. She knows every child. She's behind with me for the years now. I would also like to thank the president for coming here to give this weight to this event, and the medical university, the dean, who has been supporting the conference in many different ways. And I will just end by saying that this conference is consisted of 3 complex parts. We have the scientific part, many scientists, researchers, clinicians joining to tell you about the progress, to tell you about symptoms, to tell you how to manage the symptoms. We also have a festival for children. So if you're an adult, stay here, but we have a very rich program there happening and lots of childcare. We have been organizing this conference for months, late nights and days. And I really hope you will enjoy it. I hope I will be able to find some time to chat during the meals. And thank you very much for coming here.
Thank you very much. Dr. Igor Švab will speak on behalf of the medical faculty from Ljubljana, also being involved with Dr. Osredkar, all of you. We will also, you are doing the inspection or the review of children. There were questions in the beginning when your child is coming up. We will tell you next. So we will get the information. I will speak to the organizers and do that. Igor, the word is yours.
Thank you. It is obvious that the conference that we are opening tonight is not just another medical conference. It focuses on core values that are important to the medical faculty. This is why we are supporting it. On one hand, it emphasizes the need for scientific research and how to achieve breakthroughs in medical science, which is the foundation of evidence-based healthcare. And as such, it gives hope to patients. We are, as scientists and experts, want to provide health to the next generation who until now have not the possibility of achieving it. This is one of our main missions. But also this conference is also a result of a work of dedicated people who have faced an almost unsurmountable problem and achieved incredible successes. The conference is proof of what can be achieved when one's primary motivation is the welfare of others, rather than vanity, the pursuit of private privileges and money. This is also what we are trying to teach young future doctors. Therefore, when we were asked to support the conference, we did not hesitate. We are proud to support this endeavor. So instead of you thanking us for supporting us, it should be us thanking you to remind us once again what our true values are. Thank you very much.
Dr. Švab, thank you very much. And with this, I would like to invite our president, Dr. Nataša Pirc Musar, to address the audience.
Kot predsednica Republike Slovenije moram nekaj besed seveda povedati v slovenskem jeziku, to je po protokolu. Skratka, dobro jutro vsem skupaj in najlepša hvala za povabilo. As a president of the Republic of Slovenia, I had to speak some Slovenian words. That's by the protocol, so don't be afraid. I will continue in English so that everybody will understand. Spoštovani gostje, spoštovana gospa dr. Špela Miroševič, spoštovani dekan, spoštovani profesor. Z globokim spoštovanjem in ponosom vas pozdravljam na drugi mednarodni konferenci sindroma CTNNB1 v Sloveniji. And now I will continue in English. I'm very pleased to be able to share with you this important moment, which is the result of the hard work, dedication, and extraordinary perseverance of scientists and parents. For several years now, I have been following the story of the Slovenian boy Urban and his mother, Dr. Špela Miroševič, who decided to dedicate her life to researching CTNNB1 syndrome and I have been deeply moved by it. I am proud that Slovenian science is also selflessly helping in the development of a cure, namely the pediatric clinic with Associate Professor Dr. Damjan Osredkar, the National Institute of Chemistry with Professor Dr. Roman Jerala, and the Faculty of Medicine headed by the Dean, Professor Dr. Igor Švab. Slovenia is a small country, but with a big heart and great initiative. We have once again proven that we are a nation with a lot of compassion, as we have joined forces and raised 2 million euros for the development of a cure. The population of Slovenia is 2 million, bear in mind. So basically every single Slovenian gave at least €1. The funds raised will help to complete the development of a cure and will benefit not only our Slovenian boy Urban, but all children in the world who have already been born with CTNNB1 syndrome and all future generations of children who will be diagnosed with this syndrome. As a president of the country, I am well aware of the importance of scientific research and innovation. Today, Slovenia is playing a key role in the development of the world's first gene therapy program for CTNNB1 syndrome. This program is important not only for our country, but also represents a bright hope for children and families around the world. I'm also very proud that today's conference is both the largest CTNNB1 syndrome conference in the world and the largest rare disease conference in Slovenia to date. I am delighted once again to welcome all the parents present and as many as I heard 82 children with CTNNB1 syndrome from 19 different countries. As a mother, I have to tell you, I especially admire each and everyone who decided to push the boundaries for their child. I also warmly welcome the many internationally renowned experts in neurology, genetics, and innovative drug development who, despite the rarity of the disease, have taken the time to prove that they are not only great professionals, but also people with a big heart. Together, we bear a great responsibility for all children, and we must not let them down. Today's event has convinced me that the future of treating CTNNB1 syndrome can fill us with great hope. I really wish everyone a successful conference full of new insights, inspiration, and of course, networking. May our joint efforts be directed towards a brighter future for our children. And I really do hope that all of you and your kids will have some time to go around at least the city or the rest of the beautiful country you are visiting. If not, please come back. Thank you. I forgot something. I wanted to listen to the first panel, but other obligations came into my schedule, so please do excuse me. I need to run back to the presidential office, but once again, all the best and good luck to all of you. Thank you.